Hello, and welcome to Back to the Science. I'm Dr. Susan Oliver, and I'm a scientist, and this is Cindy Oliver, and she's a dog. People who have been diagnosed with cancer are often desperate, and unfortunately, that makes them very vulnerable to scam artists offering them a cure. In this video, Cindy and I will be looking at a treatment that is claimed to be a cure for cancer, as well as a number of other conditions, and seeing if it is in fact a cure or if it is just a clever scam. The treatment that we will be looking at is Gerson therapy. Before we decide whether it is a scam or a cure, let's have a look at what Gerson therapy is. According to their website, this is how it works. The Gerson therapy's all-encompassing nature sets it apart from most other treatment methods because it restores the body's incredible ability to heal itself, rather than treating only the symptoms of a particular disease. By addressing the root causes of most degenerative diseases, toxicity and nutritional deficiency, the Gerson therapy effectively treats a wide range of different ailments. Right. Let's see how they do that. An abundance of nutrients from copious amounts of fresh organic juices are consumed daily, providing your body with a super dose of enzymes, minerals, and nutrients that is easily assimilated. In addition, raw and cooked solid foods are generously consumed. These substances then break down diseased tissue in the body, while coffee enemas aid in eliminating toxins from the liver. By the way, although they recommend sticking copious amounts of coffee up your bum, you aren't actually allowed to drink coffee while following Gerson therapy because... Anyway, let's go on. Oxygenation is usually more than doubled, as oxygen deficiency in the blood contributes to many degenerative diseases. The metabolism is also stimulated through the addition of thyroid, potassium, and other supplements, and by avoiding heavy animal fats, excess protein, sodium, and other toxins. With generous, high-quality nutrition, increased oxygen availability, detoxification, and improved metabolism, the cells and the body can regenerate, become healthy, and prevent future illness. Well, I must say that sounds totally ridiculous and completely inconsistent with what we know about cancer and other diseases. But where's the scam? Because let's face it, you could do all that at home if you were so inclined. Hang on. It's in the last line. Always work with a Gerson practitioner to develop and monitor a personalised protocol. You can't do it yourself. You must hook up with a Gerson practitioner. I wonder how you can do that. Oh, look, there are two options. You can go to a licensed Gerson therapy clinic or get help through web-based care management. In both cases, you need to continue treatment for at least 2 years with regular follow-up consultations. So, how much does this actually cost? Well, the licensed Gerson clinics cost about $6,000 per week, and that doesn't include transportation to and from the clinic, adjunctive treatments, and monthly follow-up consultations, which you have to have for 2 years. But hey, you do get $500 off a week if you are a returning patient. It's a bit cheaper if you choose to go for web-based care management. The cost does vary slightly depending on who you choose, and these are just a few of the certified Gerson practitioners available. But a typical consultation costs around $500 US for the initial consultation and $275 US for follow-up consultations. And remember, you need to have monthly consultations for a period of 2 years. And by the way, in order to become a certified Gerson practitioner, you need to complete a 2-year training course at a cost of $20,000 US. The Gerson Therapy Institute also makes money through selling supplies and books. So they clearly satisfy the money-making criteria for a scam. Of course, you can also pay for treatments that do work if you live somewhere that doesn't offer universal healthcare. So the fact that you have to pay for Gerson therapy doesn't in itself make it a scam. It's only a scam if you're paying for something that isn't going to help you at all. So let's have a look to see if Gerson therapy actually works. The overall premise of Gerson therapy is that it works by detoxifying your body. This is a pretty strange claim because your body already has organs that detoxify it, like your liver and your kidneys. So it's not exactly clear why you would need anything else. But apparently you do. And in particular, you need to have lots of coffee enemas every day and super doses of enzymes. Oh, and by the way, you can purchase your own Gerson coffee enema kit from the Gerson Institute for $26 US plus shipping. For that, you get a bucket, some plastic tubes, and a small packet of coffee. And it's not just any bucket, it's BPA and latex free. As is this bucket, which I bought for $1 from my local hardware store. Oh, and as Cindy pointed out, it's rather silly having a latex free bucket when the kit also includes a rubber latex catheter. But back to the claims. The whole rationale for treating cancer with coffee enemas and diet was evaluated in this article here, and it was found to be wanting. In particular, the author found that the various enzymes included in the diet and as supplements would be extremely unlikely to survive the stomach and pass into the bloodstream. He also found that roasted coffee didn't even contain the compounds that were meant to stimulate the liver. And most importantly, he found that the whole premise of Gerson therapy is based on a misunderstanding of why cancer occurs. And furthermore, sticking copious amounts of coffee up your bum is not without risk. There have been a number of deaths related to coffee enemas. But what about the 50 patients who Max Gerson treated for cancer and cured that you can read all about in this book for a mere $25 US plus shipping? An NCS analysis of Dr. Gerson's book concluded in 1959 that most of the cases failed to meet the criteria for proper evaluation of a cancer case. Furthermore, according to retired General Surgeon Peter Moran, who reviewed each case, 2 did not have cancer at all, or even the beginning of tumours. 8 did not have cancer at the time of Gerson's treatment. 4 had tumours or suspected tumours that were benign. 31 did not have a biopsy or other incontrovertible evidence of cancer. This does not exclude cancer, but leaves varying degrees of doubt. 15 were diagnosed wholly upon Gerson's personal clinical judgment. 8 had cancer, but their outcome can be attributed to other treatments they received. 4 were not followed up for the cases to be meaningful. 2 had clear indications of persistent or worsening cancer despite being treated by Gerson, although Gerson tries to dance around this. 4 are consistent with the natural progress of the condition or other treatments received. This only leaves 4 of the 50 cases that even moderately suggests that the treatment was effective. However, no information is given on other treatments they received or that the biopsies or other evidence given for cancer was interpreted correctly. But hey, the book was originally published in the 1950s. Surely since then, the Gerson Institute has done randomised controlled trials so that its efficacy can be properly assessed. Yes, I'm being facetious. Of course, they haven't done any clinical trials. However, a clinical trial has been done on a treatment that is very similar to Gerson therapy, where it was compared with chemotherapy. It has the special diet, the supplements, the enzymes, and of course, the coffee enemas. They originally intended that it be a randomised trial, but no one was willing to be randomised. So instead, they let the patients choose which treatment they wanted. And this is what they found. There was a 9.7-month difference in median survival between the chemotherapy group, which had a median survival of 14 months, and the enzyme treatment group, which had a median survival of 4.3 months. At 1 year, 56% of the chemotherapy group patients were alive, whilst 16% of the enzyme therapy patients were alive. And finally, the quality of life ratings were better in the chemotherapy group than in the enzyme treated group. So, patients on the enzyme therapy, which included a special diet and coffee enemas, did substantially worse than those who used conventional chemotherapy. For some strange reason, Gerson therapy advocates don't talk about this trial. But what about the testimonials? Surely all those people can't be wrong. The important thing to remember is that people giving testimonials are unlikely to be representative of all patients. In particular, dead people can't give testimonials. And generally, their stories don't get out. Occasionally, though, they do. One particular case is the late Australian wellness blogger, Jess Ainscough, who chose to not undergo conventional cancer treatment and instead followed Gerson therapy before her untimely death from cancer at age 30 in February 2015. She was a firm advocate of Gerson therapy and went by the nickname the Wellness Warrior. Jess's mother, Sharon, also followed her daughter's lead and used Gerson therapy when she was diagnosed with breast cancer. Sharon died from her cancer in 2014. And then there's this lady here, Fiorella Agula. She had surgery when she was diagnosed with breast cancer, but decided not to have the recommended chemotherapy and instead raised money to go to Mexico and have Gerson therapy. She passed away from her cancer in 2022. But what about the testimonials on the Gerson Institute website? For instance, there's this heartwarming story about Carrie Dugo's recovery from breast cancer on Gerson therapy, which was posted on the Gerson website on the 27th of October in 2014. Here's an update from Carrie from a different website called You Can Thrive on the 24th of October 2018. I've been in hospice care for over a month now. Some days are good, some days are harder. She didn't recover from breast cancer, as was claimed on the Gerson website. The cancer took her life. But what about the people who appear to have really been cured by Gerson therapy? Well, in a lot of cases, there are other explanations for their cures. Like, for instance, this lady here, who did pass away at age 74, but had survived 25 years following her cancer diagnosis. If you read her story, she had surgery for her breast cancer prior to commencing Gerson therapy. What a lot of people don't realise is that in many cases, cancer can be cured by surgery alone. Subsequent chemotherapy and radiotherapy is often only recommended as adjunct therapy. The reason for this is that you can never be 100% certain that you have got all the cancer. So, undergoing a round of chemotherapy can kill any cancer cells that have been left behind. And by doing this, it increases your chances of survival. But the important thing to note is that a lot of people will still survive even if they don't have chemotherapy. They have been cured by surgery. And having Gerson therapy when your cancer has already been cured by surgery is just an uncomfortable, expensive, and potentially dangerous waste of time. And some Gerson therapy patients aren't just cured by surgery. In some cases, Gerson therapy practitioners actually recommend that their patients do still get chemotherapy. These patients would still be chalked up as successful Gerson therapy treatments, even though it's more likely that they were cured by conventional treatment. As far as all the patients that don't survive, there is an easy inbuilt excuse that can be used. According to the Gerson Institute, you need to follow their arduous therapy, which includes several daily coffee enemas, huge quantities of juices, and a strict diet, to the letter for a period of 2 years. If anyone dies whilst on Gerson therapy, they can simply claim that they weren't following the therapy correctly and wash their hands of it. So, in summary, Gerson therapy is a scam which has cost people's lives in the past and sadly is likely to continue to cost lives in the future. And even people who don't die are likely to have endured an unpleasant, expensive regime for no reason. If you'd like to look further into the data I presented, I provided links in the video's description. And please remember, this video is about the science, but you shouldn't take it as medical advice. For that, you should speak to your medical practitioner. If you've got this far, thank you for listening. And if you've liked, shared, or commented on the video, double thank you, because that helps the algorithm and means that more people will see the video. And of course, thank you to everyone who has bought me a coffee or little sleepy Cindy here a treat. We really appreciate your support. We will be continuing to make videos about the science in the future. So if you'd like to join the cool kids and stay informed, please hit the subscribe button. Thank you.